Hi guys, so my name is Lizzie Bosch and I did my case study project on the cardiovascular system and hypertension. Physiology of the cardiovascular system. The cardiovascular system consists of the heart, arteries, arterioles, capillaries, venules, and veins. It supplies blood to the body cells and removes waste from the cells. By responding to a variety of stimuli, it can control the velocity and amount of blood carried throughout the blood vessels. The pulmonary circuit gets rid of carbon dioxide and picks up oxygen in the lungs, and the systemic circuit delivers oxygen to the cells and removes carbon dioxide and other waste products. If the physiology of the cardiovascular system is impaired, the body cells wouldn't receive enough nutrients and oxygen, which is necessary for energy, growth, and repair of the body. The body cells will also become overcome with waste products. Hypertension is also known as high blood pressure. Blood pressure is determined by the volume of blood pumped out of the heart and the amount of resistance to blood flow in the arteries. This occurs when the long-term force of blood against the artery walls is too high. It involves an increase in arteriolar vasoconstriction, which can be caused by increased susceptibility to stimulation and/or increased stimulation from a variety of things. Even a slight decrease in the diameter of the arteries can cause a major increase in peripheral resistance, reducing the capacity of the circulatory system and increasing the diastolic pressure or afterload of the left ventricle substantially. Normal blood pressure for most adults is 120/80, and a hypertensive blood pressure for most adults is 140/90. This little picture right here shows what I think is a really good graphic of what factors into blood pressure. So there's cardiac output, which is affected by heart rate and stroke volume, and then peripheral resistance can be affected by aldosterone, angiotensin, and renin. How hypertension affects the body's physiology. Elevated blood pressure can cause damage to blood vessels and various organs. The higher the blood pressure and the longer it's uncontrolled, the more severe the damage will be. High blood pressure may weaken the heart and cause it to become too weak to pump blood through the body efficiently. Some complications of severe hypertension are heart attack, stroke, aneurysm, heart failure, weakened and narrowed blood vessels in the kidneys and eyes, metabolic syndrome, and trouble with memory or understanding, and dementia. Signs and symptoms of hypertension. Hypertension is typically asymptomatic in the early stages and is often called a silent killer. Some initial nonspecific signs are fatigue, malaise, and morning headache. Progressive signs include nosebleeds, vision problems, chest pain, difficulty breathing, fainting, and lightheadedness. The majority of the symptoms can be written off as signs of other diseases and are not specific to hypertension alone, making it harder to pinpoint the disease without regularly monitoring blood pressure. And because the disease is so asymptomatic, this is what can make it very dangerous, and that's why it's called the silent killer. So treatment of hypertension usually begins with lifestyle changes like decreasing salt intake, reducing body weight and stress, and increasing cardiovascular fitness. There's various medications that can be taken, like diuretics, which boost the release of fluids through the kidneys, lessening the blood volume. There's angiotensin converting enzyme inhibitors and calcium channel blockers, which act to dilate the blood vessels, reducing resistance to blood flow. And there's also beta blockers, which slow the heart, reducing the amount of blood that's pumped. A combination of these medications have also proved to be effective. By following the prescribed treatment plan, most patients are able to live a relatively normal life with very few physiologic limitations. Recovery and physiologic limitations may be more extensive if the prescribed treatment plan is not followed and serious cardiovascular complications occur. Otherwise, if blood pressure is monitored and kept in a healthy range by following lifestyle changes and medications, usually hypertensive patients are able to live a normal life without worrying about serious complications. Declining stages and changes in lifespan. The declining stages of hypertension put the patient at a higher risk for cardiovascular complications. Changes in lifespan depend on the type of complication, but uncontrolled hypertension is very scary because it can cause premature death if it's not monitored. How caregivers can help patients with hypertension. They can remind patients to take their medications. They can prepare healthy meals that are low in sodium, remind them to not drink alcohol and have a low cholesterol diet. They can encourage them to exercise, especially cardiovascular exercises, and they can monitor their blood pressure. One way that's really cool to monitor the blood pressure is through one of these at-home sphygmomanometers that allows the patient to monitor their blood pressure without actually going into the doctor. So they can monitor it on a more regular basis and not have to rely on always going into a doctor's office to find out where their blood pressure measurements are at. Like, another thing is just to make sure the patients are following all the doctor's recommendations. Even things that seem insignificant to the patient may play a big role in getting the hypertension under control. And those are my references. Thanks for watching, guys.